Hi friends, welcome back to my channel. Today we are going to discuss an OIT letter. It is a letter to a nursing care home manager. So let's see the case note first. Assume that today's date is 18 December 2021. Mr. Ron Pederson, a 68-year-old, is a patient in the clinic where you work as a charge nurse. So you got the information from here. The patient's name is Ron Pederson and his age is 68 years old. And what is the position of yours? You are a charge nurse, you are working in a clinic. So the hospital name is given North Middlesex Hospital, 48 Main Street, Newtown. Then patient details, again the name is mentioned, date of birth is mentioned, marital status is widowed. Then presenting complaint. Today patient presented with weakness in leg, body imbalance, severe stiffness of joints, episode of fall at home and muscle cramps or spasm. Then on examination, patient is reluctant to receive help, concerned about symptoms, want to be independent. Initially I told you that this is a letter to a nursing care home manager. So let's see the writing task first. So write a letter to nursing manager in Sunview Care Home for admission and care of a 68-year-old patient who has early stage of PMA. That is a disease condition called progressive muscular atrophy. Then address your letter to Miss Veronica Dennis, Sunview Care Home, 222 Main Road, Stillwater. So when we are writing to a nursing home, you should know whether it is known case or unknown case, because here in the European countries most of the patients they are staying in the nursing home when they are old, and if their condition is worsened or they need some acute care, means they will transfer to hospital and they will go back to their nursing home itself. So in that case, they know the patient's history. That means the medical and social history. We don't want to mention it again to them. So that's why we have to make sure whether it's a known case or unknown case. So where we can see the information, where you can get the information whether it's a known case or unknown case. We can see from the address itself. If it's the same address, it means that patient came from there, or it will be mentioned like that it's a patient's the nurse who was looking after him before his admission, like that they can mention. So in that case, or going back to his nursing home, something like that they will mention in the letter, so no need to worry about that situation. So here we can see whether it's a known case or unknown case. When we go through this social history, it's not mentioned any address from the nursing home, and it is not in the same place. Nothing, no information is given. And in the next page, it's mentioned that the two daughters, one usually visits him but unable to take care of him as she is sick. So it's clear from here that it's an unknown case. So we are referring the patient to the nursing home for the first time. So we should mention about the social history, medical history, everything. Okay. So let's start again. As the first, how the patient came, then what all things they have done in their hospital, which is mentioned. So first came with the weakness in the body, in the leg, then imbalanced body, then they did the nerve conduction test, electromyography, the diagnosis progressive muscular atrophy, then medications given, magnesium, paracetamol and riluzole. Social history, is a widower and retired, consumes alcohol 6 units per week, ex-smoker, earlier 20 cigarettes, reduced number. So it's already ex-smoker, so even though it's not mentioned, it's okay. Next is mentioned obese, not following regular exercise, two daughters, one usually visits him but unable to take care of him as she is sick, she is diabetic. Then medical history, in 2015 angina, atherosclerosis, inserted stent, medicine, she is using nitroglycerin. 2016 Alzheimer's disease but ruled out. Ruled out means it's excluded and it's not diagnosed, there is no Alzheimer's for him. That is the meaning. I have done one video before, just watch it. I am telling that because many of us think that ruled out means is confirmed. So because usually in the hospital we are saying that we are doing the CT brain to rule out ICH like that. So we are thinking like to confirm ICH or any brain hemorrhage like that. So let's go back to the case note. January 2021 CT brain scan stroke rolled out. That also means there was no stroke. February 2021 referred to neurologist for further management. Then he has family history of stroke because his grandparent died due to stroke. Then what is the discharge plan? Moved to independent room with 24 hours nursing support. Needs emotional support as he is reluctant to move to nursing home earlier, now willing to move. Then refer occupational therapy, needs regular physiotherapy. Next is monitor side effects of medication. So these are the discharge plan. That means the recommendation they are asking. So let's see how we can write a sample letter.